My name is Katie Veraldi. I'm a LPCC for undergrad. I just went to CSU up in Fort Collins. Through that, I worked at a place called Sava, which is like a phone advocate for people who have experienced sexual violence. I was on call. And then I also worked at a place called Harmony House. So that was helping parents and families who are going through the judicial system for custody. I took a couple years off. I worked at the Mental Health Center of Denver. I was a case manager, and I worked a lot with addiction and chronic mental health and homelessness. And then I was part of a pilot program that was there to help people get out of jail if they were waiting for a competency evaluation. And then I was like, I still want to do the counseling. So went to Wake Forest for grad school, and I did clinical mental health, and I worked at a middle school. So I really specialize a lot in body dysmorphia, body image, eating disorders, as well as like anxiety and depression and ADHD. I've been doing a lot of work with. And then also grief. I did some extra training in grad school, also with addiction, and then sex therapy as well. I do notice a big chunk of my clientele tends to be 25 to about 55. And I really do enjoy that because there's a lot of like life transitions that are happening. I use like a lot of cognitive theories and then humanistic theories. So the reason I like both of those is it kind of melds, I think, what we think of like traditional talk therapy. Kind of that humanistic side is being able to be there and just fully listen and reflect and kind of help you maybe see some patterns tied in with the cognitive parts. You get to leave sometimes with this like really concrete knowledge of like, this is a skill I can use when I'm really anxious. I really like a book that was written by a therapist called Therapy is Awkward Sometimes. And I would say that's true. In some ways, coming in and leaning into, if it's your first time trying it, and your therapist should be ready and open with like questions. You know, it's my favorite when clients come in and they ask, why would you do this? Right? Or like, what is it that you do? What am I doing here? You know, I think leaning into that and knowing that it's actually really natural